Children and parents aren't the only ones who struggle to find dental care in Oklahoma. The state ranks among the worst in the nation for dental health, with low numbers of adults regularly seeing a dentist and high percentages of cavities and teeth extractions. Oklahoma Watch has been compiling research on Oklahoma's dental health, and I spoke with its executive director, David Fritze, about what they've found. David, why is Oklahoma doing so badly in dental care?
Well, I think a lot of the reason has to do, well, some of the same factors that we face in just with health insurance in general. Right now, I'd say about 17% of people don't have general health insurance. Well, like 50% of people don't have dental insurance, and there are a number of reasons. But they all have the similar underlying factors. We have some high rates of poverty in areas. We have shortages of dentists as well as doctors in rural areas. And just a number of factors come into play. But, it's a very serious issue. You can sort of look at oral health care and say, it's like taking the temperature of our health or our overall well-being in general. And there are many consequences that are serious. For example, children who don't have dental insurance or don't get dental care, they'll be facing, they can't learn, they can't play, they have self-esteem problems. It's certainly an issue that we need to focus on.
So when people get to the dentist, they're getting good care, just not enough for getting there.
Yes, exactly. And there are various factors. I mentioned the shortage of dentists, but also there's the fact that there's a lack of dental education. A lot of people who are eligible to be served by Medicaid don't take advantage of it and get the dental care for their children with Medicaid. By the same token, there are a lot of dentists who either won't set up practice in rural areas, for example, in some of these underserved areas, or also won't take Medicaid patients.
You've talked about dental deserts in your reporting. What are those?
Well, those are areas, again, where there are just not very many dentists. There are counties out there who don't have, have just a handful of doctors. Now imagine with dentists as well. Dentists come out of school with, say, a couple $100,000 in debt. They're going to want to set up practice in urban areas where there are more customers, more people who have insurance and who are willing to pay the out-of-pocket cost.
Is there an incentive program to alleviate this problem?
There have been, the state has taken a number of steps. There was a governor's task force that I think came out in 2007 to try and do some things to improve, spread the benefits of dental care, to address some of these issues. And then the Dental Association in Oklahoma offers a number of programs. They combine to do sort of a mission of mercy to offer dental care once a year in one place to serve an area. And the state itself has a program to sort of subsidize dentists who are willing to go out into, say, a small community and set up shop as long as they serve at least 30% of patients who are Medicaid related. But our numbers keep slipping. For example, we are the last in the nation when it comes to the percentage of adults who have seen a dentist in the previous year, the last in the nation. That number has been dropping. We used to be well above 60%. We're now at 57%. So over the last decade, it just has not improved.
How important is it for people to drink fluoridated water?
Well, the federal Centers for Disease Control will say that it's one of the great public health advances of the last century. It remains controversial, though. You'll find in some communities that there's a lot of opposition to fluoridated water. But so far, most health experts say adjusting the fluoride in drinking water is very beneficial to people. But in recent years, a number of communities out in Oklahoma have been stopping their fluoridation of water, partly for costs. They'll say the feeder systems for fluoride are too expensive. And so you have even the town of Nowata, which was the first community in Oklahoma to fluoridate its water, no longer does so.
David Fritze from Oklahoma Watch, thank you.
You're welcome, thank you.